And so I believe that folks should be seeing a pop-up box that asks you to be aware and to accept that this is being recorded. I would just say that with the recording and just in general, we ask people to be mindful about the information that you're sharing about yourself, your loved ones, your family, the people that you work for if you are a provider, and to beware not to share protected health information, PII, or PII, which is protected or personal identifying information, if you don't want to do that. We have the agenda on the screen. Thank you. And there was a reminder about the attendance link. You'll see it on the screen. I think it's probably in the chat as well. The attendance link is there. Thanks, Emily. So I just want to do a little housekeeping and to say that I'm going to add a tool to the facilitation tool that I use here. And for those of you who have been part of the case management redesign meetings, if we have such large meetings here, what I'm going to do is when we're going to use the speaker's queue as we do, and we're going to, I'm going to take names, whether it's people raising their hand in the webinar, which I think is ideal for us. If you can do that, we'd appreciate that. And the other way is, is to type your name in the chat. But if you can use your hand in the webinar, that would be great. And then, as always, we have people who are on the phone, and those people can, when I call on them to unmute their phone and give me their name, please do that. What I'm going to do is to have when a person is in the queue and is up to bat, so to speak, you will have the opportunity to give one question or one comment, and we will do a 2-minute limit in terms of your speaking to describe your question or comment and any follow-up that happens. So the reason I'm doing that is because we have some back and forth conversations that occur, and then people sometimes get into other questions while other people are waiting in the queue. So I'm going to give that a try. It seems to work well in our case management redesign meetings. So thank you. I will now ask if we can review the agreements. And just if you can scroll down, Andy, just to the second page. I'm not going to go over, these have been there. Perfect, thank you. I'm not going to go over all of them. I'm just going to summarize what I feel is just most important at the moment, but please, when you have time to look these over, these were created by stakeholders years ago. So I'm just going to say to folks, let's keep on topic. We do have the open forums where you can bring things up. The open forums are to make comments, ask questions, and we are not going to be getting into back and forth discussions during the open forum responding to questions, but we will take them. And if you're having trouble using the link to make a topic request, which is the most ideal, I think, for the whole process, but if you need to, if you're on the phone only, for example, you can use the open forum to make a topic request for the future and to make announcements that this is a community. Okay, thank you. If you can scroll back up. Any? Super. I will stop and ask the stalwart Ms. Erin Thatcher if there's anything I missed, because there's usually something that I miss in all of that. Anything, Erin? Nope, I see you shaking your head now. Perfect. So for those folks who are on the phone only for attendance purposes, and again, if you're online, please use the link. If you're on the phone, please give me your name for attendance. Okay, I see a phone number that I recognize, so I'm going to just say that Ron and Tracy Heller, I have your names down for attendance today. So you're good. Tracy, anyone else who is?
Dolores Hurley.
Dolores, welcome back.
Thank you.
Okay. She's famous, by the way, folks.
Frony, I'm clicking on the agenda where it says attendance link,
Jerry,
but
we're
it
not
doesn't let
doing,
me.
Jerry,
What?
we're not taking questions yet. We're just doing attendance.
This is an attendance issue.
An attendance issue? All we're asking for people to give us their names right now.
Hey, John, this is Erin. I think Jerry's question or comment was that she was attempting to click on the link in the agenda and then it wasn't going to the right place. Jerry, if you were able to look at the chat, we did put the attendance link there too. But if that doesn't work, let us know. Thank you.
Sorry about that, Jerry. I assume since you spoke up that you were giving me your name, because I know in the past, Jerry, that you have had trouble with the link. So I always just add your name. So, but I didn't mean to be curt, and I apologize if I tried to talk over you. Sorry. Anyone else for attendance, phone only?
Renee Farmer.
Renee, thank you. Anyone else? Okay. I will make a note to ask again later in the meeting. Thank you. So now I am going to ask if there are names for the open forum number 1, which is a 10-minute item. And let's see, Adam Markert, have you down? Thank you. Anyone else? You can type your name in the chat. You can raise your hand. Julie Riskin, looks like you are signing up for the open forum. Anyone else? You can raise your hand in the webinar. You can type your name in the chat. Rebecca Sterry. Rebecca Sterry, have you down? And anyone else? Okay, so I will start with non-vendor stakeholders, and I will start with Julie, and then Rebecca, your name is new to me. I'm assuming you are not a vendor, so we will take you after that. Julie Riskin, please go ahead.
Yeah, sure. Real quick, I'm just going to put a link in the chat, letting people know that our annual ADA celebration is the 28th of July in the evening at History Colorado, and we're honoring kind of our people that started our organization, that were involved, 30 years ago, before we had any of the cool things that we have now. And it is a fundraiser, but it's free to attend. So I put the Facebook and the registration, the Facebook event and the registration there. It is, we will have one more meeting before this, but it's like 2 days before. So I wanted to let people know. And that's it. Thank you.
Super, thanks, Julie. That's great. I imagine the department will be helping to spread the word about that month and that day in particular. So thanks. Okay, Rebecca Sterry. I don't think I've met you before. Glad to have you here. Go ahead, please. You can unmute by pressing *6.
I'm sorry, I was just telling you that I was here for the attendance.
Oh, okay. In that case, great. Looks like you may be online. If you have trouble figuring out how to use that link, glad to talk with you at some point. Thanks. And then Adam, please go ahead.
Good afternoon, everybody. This is Adam Markert. I work with Consumer Direct. I'm the program manager here. First, just let me start by saying we are a lot of spokes in the wheel to these programs, and it's awesome to see so many people in the chat and all the different spokes in the wheel. So, hey, everybody, making it all roll forward. I'm here to talk about the IHSS e-learning, which is wonderful new news. It's geared towards new members coming into IHSS each month. So each new IHSS member has the option of getting set up for e-learning, or if they wish, still getting that paper manual. But if anybody would like to check it out, current, longstanding IHSS members, family members, advocates, case managers, all of you, we're more than happy to set you up with an account. And if you'd like to do that, you just need to email us at Consumer Direct. I'm going to put into the chat our email. All of our emails end the same way with that consumerdirectcare.com. It's the front that's important, which is where you're going to send it to. And that would be our info box, info CDCO at consumerdirectcare.com. If you'd like to reach out, what that means is that they have 6 months to kind of set up with the account and complete it. And it's another method for people to get into that IHSS warning platform. Thanks, everybody.
Great, thank you, Adam. Adam, let me ask you a question. Is this something that would be available to people who are not online? And if so, give a phone number for them to call, or is this strictly an online thing you're talking about?
Oh, sure. It's a new, wait, oh, but did I unmute? I did. Okay. Amateur hour. Yes, it's another option. The manual will still be sent out by paper, but if they want, there's now an option to do it through an e-learning platform if they wish. And yes, I can put our phone number in if they wish to call and say, can you help guide me where to get set up? No worries.
I think perhaps, thank you, that's great. Maybe if you can give the phone number verbally right now for those who are on the phone.
Of course.
That would be good.
All right, everybody, our main line, 844-381-4433. That's 844-381-4433. That is Consumer Direct for Colorado.
Okay. Thanks, Adam.
You're welcome.
Do have a few minutes here, so I'm going to check to see if anyone else wants to, pardon my background noise, anyone else has an item for the open forum. About 3-4 minutes, we can do an item. You can raise your hand in the webinar, unmute your phone, give me your name, type your name in the chat. Okay. Hearing none, I will move us along. The next item is Community First Choice updates. We have someone from the CFC team, Community
We
First
do.
Choice, CFC.
Hi,
Super.
everyone. This is Christine Dos Santos from the department. Here to give just a brief update on Community First Choice, or CFC. So last month during our council meeting, we took a little bit of a deep dive into the wellness education benefit. As a reminder, I think we might have done a quick overview here at PDPPC, but just as a reminder, this is a monthly individualized educational mailer that's designed to improve member health outcomes by assisting waiver members in increasing health literacy, managing health-related issues, preventing hospitalization, promoting community living, achieving goals identified in a member's person-centered service plan, and providing actionable tools for informed decision-making and preparation for conversations with medical professionals and social services professionals. During our meeting, like I said, we went in a deep dive. We discussed this new service and what articles look like. We reviewed an example of an article with the group. And additionally, we gave a timeline just that this new service will first roll out and be available to CDASS members in March of 2024. And then all other waiver members will be able to access this service in March of 2025. We did solicit some feedback in regards to topics for articles that stakeholders would find helpful. I'm going to drop a link in our chat here so that if anyone here on the call wants to participate and just answer a brief survey about what topics they think would be really helpful in this educational mailer benefit, we greatly appreciate any feedback in that regard. And then lastly, our next meeting is next Wednesday. So Wednesday, July 5th at 10 a.m. We're going to have our next council meeting. And during that meeting, we're actually going to go through our draft wellness education benefit rule. So we'll be going through the rule line by line, reviewing that with our council members and soliciting feedback in that fashion. And that is all I have for an update. I'm more than happy to take some questions, though, if anyone has anything.
Thanks, Christine. If anyone does, you can raise your hand in the webinar to get in the queue, type your name in the chat. Unmute your phone, *6 if you're on the phone only. Okay. Thanks, Christine. Looks like nothing for now.
Oh, I do see one question in the chat. When will this roll out? I'm not sure if you're meaning community first choice or the wellness benefit, so I'll give you both. Community first choice is expected to roll out July 2025, and the wellness benefit is going to roll out for CHCBS members in March of 2024, and then all other waivers will have access to it March 2025.
Okay. Anyone else before we end this item? Questions for Christine? Comments? Okay, thanks, Christine.
Looks like
All
Julie.
right. Oh, again? Missed one? Oh, yeah. Goodness.
Yeah, sorry
Julie,
about that. Sorry, thank you. Can you just tell me when the next meeting is again? I just missed that. Thank you.
Sure, it's next Wednesday, July 5th at 10 a.m.
Perfect, thank you.
All right, and just to say, I think I'm pretty clear about this because I do take part in our calendar. We do have that meeting listed on our OCL stakeholder engagement calendar, or the ARPA calendar, I believe, also, if you want to get that information. And if anyone needs to have any help to find out where those calendars are, you can send me an email or type in the chat. I will share the link for those. Okay, thanks. Let's see. Might be it. I might actually be correct now. It looks like we have no one else. Thanks, Christine. Okay. Next up is Jessica. We're talking about our recommendation process, or the stakeholders' recommendation process. Please go ahead.
Yes, thanks, John. I'm going to take over the screen. So just one moment while I get this going. All right, hopefully y'all can see. I'll be walking through our PDPPC formal recommendation process. There's a variety of steps, and each step is owned or the responsibility of certain individuals, depending on where we are in the process. This process was outlined in a flow chart that's included in the monthly materials. So if you didn't get it or you haven't seen it yet, then I would encourage you to take a look at that. All right, so the process begins with a CDASS or IHSS issue being raised for discussion by stakeholders within PDPPC. This can often be begun with a recommendation, a request for a topic through our request form, or as conversation after a particular topic has been presented. It's not usually appropriate for this to happen in open forum. From there, we follow Robert's rules, and so a motion for a formal policy recommendation is made. And if that's passed, then a couple of things typically happen. So discussion time can be added to a meeting agenda, and that can continue for several meetings if needed. Oftentimes external work occurs. So this can be a meeting, a singular meeting, or several meetings. A work group can be formed, a survey can be made, And typically this external work is headed by one or two lead stakeholders. From there, the lead stakeholders for this recommendation complete the recommendation form. This form is on the PDPPC website. We can also email it out to individuals if there's a need for that. And then the recommendation is formally presented at PDPPC. So then from that presentation at PDPPC, a formal vote is put forth using the established voters list. As a reminder, an individual needs to have attended the last 3 meetings to be able to have voting rights. If the vote is in the negative or voted no, then a couple of things can happen. So the recommendation can be adjusted, or we can have more discussion. Stakeholders can have more discussion, or based on that discussion, if it looks like the recommendation is not well supported, this can be the end of the process for the given recommendation. That doesn't mean that it can't be brought forth again, but it just means that it probably needs to be researched and the recommendation form adjusted more thoroughly and then presented from that starting point again. Okay, so then if the vote is in the affirmative or voted yes, then that recommendation form is sent to our co-chairs, Kurt and Kevin, for review, and then they send it to the department for a formal response. The department will either research the recommendation, look at policy, look at department rule, look at rules from other departments if they're applicable, and really get a good understanding about what the recommendation entails and the implications of making any requested changes. And that's done within 20 calendar days. There is the occasion when the department may need some more time, depending on the complexity of the recommendation. And so if by the end of those 20 days, a formal response is not ready yet, the department will communicate that more time is needed and ask for understanding around extending that date to provide that response. And it is a written response. Okay, so from that response, then it is sent to the stakeholders through John's typical process to get materials out to you all. And it is scheduled for the next PDPPC to discuss and present. From there, a second vote occurs to either accept the department's response if changes are determined possible, again, following Robert's rules. If the vote is no, then the department can work with stakeholders the department can work with stakeholders to address some of the areas of concern, answer some questions, and usually that takes about a week. Any updates needed to the formal recommendation response are made, and more conversation with stakeholders is needed, and that's resent out to the group. And then from there, another vote can occur to see if it's acceptable and voted yes. Okay, so if it's voted yes, then the department gets to work on the appropriate changes that need to be made. That usually involves looking at rule, changing procedures, updating materials. It really depends on what the recommendation entails. When we've had recommendations come through, so you all might remember the background check work that went on for quite some time, the final recommendation did include a timeline, so everyone was made aware of when to expect certain things to be put in place. I think that's that. And then, so if there are questions about this, you can reach out to the Participant Directed Programs unit, and we can provide a copy of that outline again, or refer you to our co-chairs, or the questions or comments can go directly to Kurt and Kevin, and their email addresses are on the screen. I think they can also provide their phone numbers if that's necessary. So that's the end. I'm happy to take some questions about what I presented, or I know that Kurt and Kevin are with us. They can help to answer any questions anyone might have.
So folks, this is John. I have a couple people in the queue, but if you want to add yourself to that queue, and if time allows for this agenda item, we will take them. Anyone? I have Kurt, I have Jerry. Anyone else? Again, raise your hand in the webinar. You can type your name in the chat. If you're on the phone only, you can unmute your phone. Okay, looks like Kurt, you're up first.
Sure. There was one comment, I believe, on the attendance, and then we need to double check it. I don't think it's you have to attend the last 3 in a row. That is your initial way to qualify for voting. After that, you need to be involved in it, and I think you can miss 1 or 2 in a row and still vote. So let's just double check that, okay, Jessica?
Sure, yes.
Other than that, great job on this flow chart. I think it's really going to be helpful.
Yeah, I would ditto that. It's really helpful and fantastic. Kurt, actually, for you, maybe I would suggest that Kevin and you, the attendance rules, if you will, have been on the agenda for years, and perhaps if the two of you want to present those, because they are a stakeholder generated thing. And I know Julie is also very, very familiar with them. I think she helped write them, but just something to think about for the future. So maybe next month, whatever. Gary Frony, you are up next. And Jerry, let me just say I was kind of loud before, and if I was curt with you, I do apologize. Your comments are always really helpful. So I'm sorry about that, and please go ahead.
No problem. I'm sorry to. Okay, my question is for Jessica. Can you explain on the flow chart or not on the flow chart where the changes are from what you are describing today to what was in effect a month ago or at some past time? In other words, why are you spelling this out now? And I didn't understand what has been changed. Thank you.
Thanks, Jerry. I'd have to pass that over to Kurt, Kevin, maybe even John, who's been with us at PDPPC longer than I have. To my understanding and my experience in the last 3 years, the process hasn't changed. We just have never had it written down in a way that was easily understood and frankly documented in this way. And so that was really the goal, was to have this in a more accessible format. So stakeholders were really clear on what the process is. And that's largely because recently we've had recommendations come through. The background check recommendation from a year or so ago did involve a vote, and that's the first time we had voted in several years, as I understand. So I hope that helps to clear that up for you, Jerry.
Okay, so no changes as of today that you are announcing, correct?
Not that I'm announcing, correct.
Okay, thank you.
And Jerry, this is Kurt. One thing I just want to add is Jesse did a great job on this. This is our stakeholder group, and it is a policy collaborative. So we are trying to implement changes. Another one, I think you remember, we changed from the minimum age of 18 years old to work for CDASS clients to 16. So we have implemented a few things here recently. It's all a matter of discussion to see if we need to change policy. So this really gives a nice flow chart for everyone to really kind of see the whole process of what has to happen. So I just want to add that nothing's changed. I think this is something really good to outline. Keep in mind, this is a process. John, I see you got your hand up. What's up?
Yes, thank you. And again, it is stakeholder process, so I'm not commenting on that. I would just say for Jerry and everybody here, there are things for people who have been coming to this meeting for years, for example, say, oh, I've seen this before, but we always do have new people. And this visual that Jessica put a lot of work into really has upped the game of having this be more clear, more easier to understand. And since the recommendation process is so important to this, integral to the meeting, I really thank her for doing that. And I think I would imagine we once a year would throw this up on the screen and remind people, if not more frequently. The only change I can think of recently is that there's an ability for people to fill the recommendation form out. It's a fillable form online or something along those lines. Jessica, does that sound correct? There's been a little change in that area.
If it's not fillable, we can easily make it fillable. And so I'll check that.
Not fillable, but I think sharing the form with people, whereas it was more initially with the co-chairs. So something, maybe I'm misspeaking and I don't want to cause problems, but I thought there had been some slight little shift in the process, not really of determining recommendations themselves, but just in how people can access the form. Okay, thank you. So I don't see any other hands raised or anything, so I will move us forward then. We can go back to the agenda. Thank you. Okay, this month we're having an EBV update, electronic visit verification during the meeting. And Jillian, please go ahead. Let's see. Jillian, are you with us?
I don't see her quite in the attendance participants yet. Are we early?
Are we way early? Let's see, it says 1:50, it's 1:38.
So maybe.
Wonder if we can flip the two items and have Adam go next and circle back to her.
Boom. Yes. Do I get to share a screen? Wow.
Is this
Well,
the
if we
like?
I didn't know I had that kind of power. Jeez. I don't know if I can do it. I just requested from you. I don't think I can get it.
I can.
Well, the report is up on the screen now, Adam. You're all good, I think.
Oh, you have the same one. Look at this. All right. Well, thanks, everybody. Adam Markert again from CDCO. We are going to be presenting that data that came back from that FMS member satisfaction survey report. So if you are on the phone wondering what I am talking about, could you please go to the next slide? All Medicaid members receiving CDASS in Colorado were surveyed this past spring by mail or the new one through email regarding their satisfaction with the services from their FMS. Those FMS are PALCO and PPO. And that survey was conducted by us and then analyzed by us in collaboration with the FMS, as well as with the Colorado Department of Healthcare Policy Finance. The full reports, by the way, both of those surveys from PALCO and PPL are going to be available on our website. In fact, I think they went available today prior to this meeting. Next slide, please. So this year, what became new on it was that that survey could be submitted one of two different ways, either electronically or through that paper survey that has been the traditional way. The way it was done was contact information provided to us that is on file with the FMS. So if you did not get one, we were using the email or address on file with the FMS. It is always a very good idea to make sure that is up to date with your FMS. All those were emailed out with the contact we had on March 17th, which was to give them the option. Which one would you like it delivered to? Your physical address or through that electronic survey. So they had between March 17th and March 24th to kind of pick their method. If we did not get a response, the default was the paper survey sent out to their mailing address. All those surveys were sent out then to the preferred method on April 6th. They had a prepaid postage return envelope as well. And then the emailed surveys were completed using that software SurveyMonkey. That survey was live until May the 5th to return whichever one they liked. Those questions and analysis were done during a 5-point Likert scale, 5 being the most satisfied, 1 being the worst or least satisfied. So the CDASS members were asked to rate their services regarding customer service, that was both employer and the payroll functions, how that web-based systems functioned and its accessibility. And then the new question added to this survey involved the EVV specific system. That was weighted all on its own so as not to mess with the weighted validity of the other questions. There was also a second part of the survey which offered open-ended comments and recommendations. That's how the survey went out, when it went out, and how long it was out before those results were compiled. Can you please go to the next slide, John? If only I could control a screen. Here is how that data came back. Look at all those numbers. Of the ones that were mailed out, 3,444 surveys were mailed because of our awesome administrator, office manager over here at Consumer Direct. Of those thousands sent out, 387 were returned. 304 of those from PPL, 83 from PALCO. Where we saw great numbers was of the electronic surveys sent out. More than half of the ones sent out were returned from both FMS. So a mail return rate of about 11%, an electronic return rate of almost 60 in all cases. The percent of answers that came back with the rating of that highest value of 5, great, 64%, 58.6, 60% on average. Now that specific question to EVV, technology services, the average ratings were in that 4 range, 4.07, 4.19. Overall weighted questions, that 2 through 6, the ones separate from the EVV, also received average ratings of about 4.5, 4.3, 4.4. That is how the information was compiled and reported back. It's very good those electronic rates were so high. That was very good to see. Go to the next slide, please. Some things to consider when it comes to surveys is the audience and the person taking. So in those reports, you'll also see who completed it. About 40% were completed by the member themselves. About 17 was an authorized rep. And over 40%, people didn't answer which one they were. And all that written comment, all those written comments were recorded by the members. Topics within those comments were classified into common themes, categories. All the comments and coding is available for review once it's finalized and up on our website as well. Next slide, please. I will open it up to some questions I'll answer to the best of my ability. Some things to consider. If you are an authorized rep for multiple people, you did have the opportunity to have multiple surveys taken for each one. So they either received more than one paper copy or that electronic survey allowed them to take more than one. Thanks, everybody, for letting me present that content.
Thanks, Adam. If anyone has a question now for Adam, you can raise your hand in the webinar. Type your name in the chat to enter the queue. Speakers queue, or if you're on the phone only, to unmute your phone right now, press *6. Anyone over the phone?
Julie, I think. Yes, ma'am.
Yeah, I just have never seen anyone like so excited to share your screen. So yeah, so I'm just very, very happy for you that you got to do that. My question is, I was really glad to see the participation go up, I think, from last time. Were there any other differences? Like, did we give people more time? Did we do reminders? Do you think it's just the electronic that made it better? Like, I'm just curious as to what your perception is on that.
I do see the electronic was that much better option. I mean, we're doing something quickly it's kind of like that benefit of EVV in general too, where it can be done right away with results without the mail involved. So I do like that. And you and I also are on the same page with, we love the participation and want to see those numbers up. If there's anything we can do differently, great. Maybe even I do think the window to take it was the same. I don't think that was lengthened. I believe people updating their address regularly or just checking to make sure it's updated is also an extreme benefit to making sure it's not mailed or emailed to the wrong place. People update email addresses all the time. So keeping your FMS in the loop is a great idea.
Okay, anyone else? Comment, question? Raise your hand, type your name in the chat, unmute your phone. Okay.
Thank you all.
Adam,
You
thank
may
you very
have
much.
control back, John.
I have control back. I never,
I never had it. I know.
I know. I didn't want to say, but thank you. Okay, back to the agenda. And let's see, Jillian, are you with us? In Estes?
I am, yeah. I
Right.
joined just moments ago, and it's good to be here. Let me get going. Thank you for sharing your screen, Danny. Appreciate it. So my name is Jillian Estes, and I'm the EVV Policy Advisor. And I guess my presentation is going to kind of slightly piggyback off of what Adam was talking about with that FMS satisfaction survey and the EVV component. And so the department has recently put together a survey to capture feedback around manual and modified visits. So just looking at the PowerPoint, or excuse me, looking at the sheet in front of us, this is something that I put together for CDASS stakeholders with PDPPC specifically that gives some updates. And it's not typically presented in PDPPC, but it's part of the handout packet. It is for the month of June 2023. And if we were to scroll down a little bit, Danny. Thank you. We typically cover that compliance match rate. We give you guys an idea of what the last 3 months have looked like in terms of EVV compliance and that strike protocol. As you can see, for the last few months, there haven't been any strikes. We are starting to move into another aspect of our compliance program. And that is getting into, we've been concerned with what's our matching rate. And now we're starting to look at with those visits that have matched to a claim, what about the quality of them? And so I have laid out here just briefly what an unmodified and a modified EVV visit are. Unmodified is EVV captured at time of service. It's real time and it's best practice. And then the modified EVV, which is visit with one or more of those verification data points. And remember, there are 6. One of those is modified after the time of service. And in some cases, maybe it's just the visit was configured what I call from scratch. So it's compliant, but it's not best practice. And so we're talking about collecting EVV at time of service and how it can help employer of record to review and approve services provided in a more efficient manner. That being said, on this particular handout, we've broken down for you to see how is CDASS doing as a program with EVV in terms of modified and unmodified visits. So that's 61% modified and 39% unmodified. And going back, best practice is unmodified. So we're at about 39% there. So what I'm presenting to you today is this information to inform, and if we can go up just a little bit, Danny, sorry about that, to get you all over the place and for everybody viewing. you'll notice that first bullet point under quality unmodified and modified EVV, it says CDASS stakeholders take 2 minutes to share your EVV collection experience. Click here to provide your feedback. And I'm happy to drop that link into the chat, but the goal here is, so we're seeing that we're 39% unmodified and 61% modified. What gives, right? Like what could be contributing to that? And so far, this survey has been out since the 15th of May, and we have a handful of CDASS participation, and kind of going back to what Adam and Julie were talking about is that participation piece. Like we would love to have your feedback, answer these questions about, you know, what's causing modified visits, and what are, you know, not only the reasons, but maybe there's reasons outside of that list that I have there, and any best practices, any things that you've identified to help improve that. And so we just want to make sure that we have good representation to better inform tips and tools and, you know, just the program in terms of compliance overall. So I'm going to stop there. And are there any questions? I'm going to dig this link out and I'm going to drop it in the chat. And I have, it seems like I've got a little unstable connection, so I'll do my best here.
Okay, this is John again. We have one hand up in the queue so far. Anyone else? Questions, comments for Jillian? You can type your name in the chat, unmute your phone if you're on the phone, *6. Hearing none on the phone, I'll be monitoring the chat. Kurt, go ahead, please.
That's great that you had some feedback there on that. A few things I'll just say from personal observation. And we even have had for quite a while a breakout group regarding EVV, in particular, one of the vendors and their, I would say the app not working properly. And recently I've seen that with the app for the FMS vendor that I use as well. So a lot of those modifications are simply that the app's not working properly regarding best practices, in addition to even having a cell phone and internet signal. It takes a long time for the app to download. And by the time attendants get into work, they say, heck with that, we need to get in there, and they'll log in after the fact. I think that happens a lot more frequently than people realize. So when you look at modified versus unmodified, as soon as they leave and it's not at the time that they were actually doing the work, I think you're going to see a lot of modified ones just simply because of application issues. So my 2 cents on that. And that's probably the biggest one I think that I see. Like I said, once they get in, if they're running late, they try to quick log in. It's like when it takes too much time, they just forget about it and do it later. So I think that's what's happening.
Got it. Thanks, Kurt. Appreciate that. So far, what we've seen is a high emphasis on forgetting to clock in and out. That seems to be a really common one. But you know, we again welcome your feedback, because maybe that's, you know, maybe there's a little more information than that. And so we'd like to see what folks have to say.
And the thing I've talked to a few of my attendants regarding it as well is partly that when it takes so much time to download and do it, at some point it's like, you know, it's not quick, easy, and dependable. So they just get out of the habit of having to log in and out. And I know personally I have to remind them, hey, you got to get your times in. So it'd be nice if it was just really dependable, like punching the clock and it happened.
Yeah, thank you. Yeah, I think that you know, we're definitely in that first year and a half now of working through what has worked and what hasn't worked. And yeah, so we're definitely interested in gathering this information so we can, you know, always working to control the things that are in our control. And I apologize that link was the incorrect one. I have sent a corrected one. If you have any challenges with that, it is hyperlinked in that one-page document.
Okay, thank you, Kurt. I believe there might have been someone on the phone trying to give me their name before, and I apologize if you got cut off. Is there someone else?
Renee.
Renee, please go ahead. Thank you.
You were saying something about the bullet points somewhere. Where I'm looking through the papers and I'm not seeing. All I see is for EVV is the electronic visit verification CDASS update page.
Okay, on that update page, you'll notice there's an arrow that is pointing. It's got 3 blocks on it. Below that is another section. It has 4 bullet points, and the section is titled Quality, Unmodified, and Modified EVV. That first bullet point, that first bullet point that says CDASS stakeholders take 2 minutes to share your EVV collection experience. Click here to provide your feedback. And so the here is hyperlinked if you wanted to click on that.
Oh, okay. Okay, great. Thank you.
Absolutely. I also see Kelly Tobin in the chat, and it's your question or your comment is, last I saw the Palco app did not provide an app not working option. So this is your feedback. So you can make that comment. There is a free text in that survey that will allow you to make that reference, Kelly. But the basic gist of it is, what is your experience as a stakeholder? And so you can select that box. App malfunction, I think, is what how it reads. But that is one way that you can provide that information. And we've kind of decided that it breaks down into about 4 buckets. And that is there's something, if it's provider, if there's provider involved, it's provider based, it's caregiver based, it's member based, or it's technology based. And it seems like those 4 categories capture where these issues where the things that are contributing to modified EVV are coming from. And so, some of those things are definitely in our control, and we can put out information and tips and that sort of thing. And then some of that is, is about feedback to the vendor who owns the app or whatever that is. Just signed in trying to figure out where we are.
Like we might have a question from Arnetta. Arnetta, if this is related to EVV, have you go. Super.
Okay, so I just had a feedback for the EVV. We seem to have the most modifications done with relative care providers. And it stems from them going over the authorized time for those visits. And so we're pretty much doing adjustments for quite a few visits. I'm just curious, is that happening elsewhere?
Yes, of course it does. It happens for lots of reasons. Sometimes people forget, or sometimes there's the lack of realization that it's really pretty critical to clock out when it's time to clock out. And relative care is often kind of fluid, right? And people don't necessarily see, where does the service end and where does my being a family member just helping out begin? And so it's really a modification of behavior and being diligent and clocking out at, oh, this is the end of my paid time. Now I'm switching over to unpaid time. But it kind of goes back to behavior modification, right? Just changing one's habit.
Okay, looks like we have 2 hands now. I believe Kurt, you went first, and then we'll go to Robin.
Sure. My question regarding relatives working and for getting logged in or out. Just a reminder to everyone, if they are live-in, they can fill out their live-in exemption, which exempts them from having to go back and have to remodify stuff, or logging in out. Now, granted, they got to log out and log in based on the hours they actually work. And my apologies, we got my lawnmower guy outside, but I'm just wondering if those are live-in ones where that probably wouldn't necessarily be a modification. I guess it would still be modified, but it would be allowed. Does that make sense what I'm saying?
Well, Kurt, I think you're talking about, and these often get interchanged. Relative provider does not necessarily mean live-in, and live-in doesn't mean relative, right? And so it's a good point you bring up that live-in caregivers are allowed in Colorado to be EVV exempt. And so with that, then modified, unmodified is not even a question, right? Because there's an exemption there. But if they're a relative caregiver, but they don't live with the member and they're providing those services, then they would still be accountable to EVV, and therefore, that's where the modification would be looked at.
Okay, I was just wondering if people realize that they can be live-in exempt, and it does have to be done annually. It does not renew automatically. So just thought I'd throw that out there. All right.
Thank you so much, Kurt.
Yeah, thank
Thanks,
you.
Kurt. Robin, you're
yeah,
up next.
Oh, why do my dogs always bark when it's my turn? But I guess along with Kurt, that was also my question is, so as live-in attendants, are we all being counted as modified, which would skew those numbers? So have you, when you look at the 61% modified, have you pulled out the live-in attendants from that? Or are you just looking at who's using the portal rather than EVV? I know in our home, I'm a live-in attendant, so would be considered modified, I guess. Maybe of 6 people, we have 1 or 2 people having to change timesheets due to the EVV app not capturing time correctly. That's or not working that day.
Okay. So
and
Robin,
it's rare. It's quite rare that it's done other than for a living.
Okay. Because I know we're running out of time, I want to make sure that I get that clarified for everyone, including yourself. So these numbers do not include living caregiver claims, right? So all these services could be EVV required, except the living caregiver data is not included. So this modified is only for your traditional caregiver or attendant who is responsible for collecting EVV.
Would it be possible to get that information without relative providers at all?
That's a great question, Arnetta. Well, I think that was Arnetta, sorry. I would have to take that back because we are not necessarily looking at it through the lens of kind of how you're authorized, right? That goes back to your prior authorization. Is it relative or not? That's not necessarily the emphasis of this information.
Okay, thank you.
Okay, we have Jillian, we have one more hand up, and I think that's what we have time for today for EVV, and then we'll move forward. Nathan, thank you. Go ahead.
Hi, I was wondering, if somebody is a live-in and they claim exempt, can they still use the software to log in and out for records?
Right. So it's my understanding that the way the FMSs, both PALCO and public partnerships, allow for timekeeping, there is an electronic allowance. And so it's and I would appreciate if someone can confirm this, that the electronic app, the mobile app, can be used to collect information even if you are EVV exempt. That's my understanding. Can I get confirmation just so we're all on the same page?
I don't know if Rebecca is here for PPL, but I know the Time for Care app does allow it to be entered whether you live in or not.
Hi, this is Nicole from Palco. I can just answer first. You would have to give us the device ID and register the device, but yeah, anybody can use the app.
Great, because it's obviously much easier to use EVV than paper, more convenient, but I just wasn't sure if you could actually be exempted but still utilize the conveniences. So that's good to hear.
Thanks for the question.
Okay, thank you. And thank you, Jillian.
Yeah, happy to be here. Look forward to your responses, folks. Thanks for your time.
Okay, so we are doing a slight agenda shift. We can go back to the agenda on the screen. Folks, we are going to do item number 13. We've been ahead of time and we have the break at 2:20. Item 13 is questions. If we can scroll down just a tad. PDPPC requests, a request for this item, questions for the Colorado Department of Labor and Employment. Thanks, Emily.
Thanks, Joe. This is Emily Harvey with the department. So last month there was some discussion regarding the Colorado Department of Labor and Employment and some questions that were coming up that would be more appropriately directed to them. And so we thought we would provide an opportunity to be able to gather questions and if they would be willing to come at a future PDPPC meeting. And we thought it would be a good idea to provide those questions in advance so they can have some time to prepare. So what we would like to do is we would like to open up the floor to be able to provide the department with the questions that might be burning on your mind here for CDLE. So with that, we can go ahead and open up a queue and start taking those questions.
Very good, Emily. Would it be all right if someone also just put their question in the chat if they preferred that?
Absolutely, if that's something that you prefer. And in fact, probably preferred, so it could be recorded verbatim.
All right. Thank you. Julie Riskin, you're up first. Thank you.
Thanks. The two questions I had is how does family, family with an I, FAMLI, apply to CDASS? Because I don't think our people have gotten any information on it. And the second question is the same, but with Colorado Secure Savings. Oh,
okay.
And sorry, I have one more, which is we really need clarity on this unemployment issue. It sounds like we're supposed to be paying into unemployment, but I don't know that they are. And so how do we fix that? People are being told they can't get unemployment. Family members, live-in caregivers are told they can't get unemployment because no one's paid into it. So how are they tracking that?
Okay, thank you, Julie. I think there was someone earlier who also had their hand up and it went away. So if there's someone else, if you had your hand up, we'd love to hear from you. Oh, Lorraine,
like
okay.
Lorraine. Yep.
Yeah. Anyone else?
John, I got one quick comment.
Okay.
I want to ditto what Julia is saying, both regarding the savings as the FMLA. I don't think a lot of information was passed forward to us as employers as far as what our employees' benefit may be and when they take effect and what we have to do. So I just want to ditto that.
Thanks, Kurt.
Okay. Thank you very much. Is there anyone else who has a question for the CDLE, Colorado Department of Labor and Employment, that you want? See if we can get in front of them. Have them come. All of the things that Emily said before. Julie, go ahead, please.
Yeah, just one more. If they could tell us what we can advise our employees to do when, if an FMS messes up their taxes, what is their responsibility, and what can employees and employers do in those situations? Because we sign over, I think it's a power of attorney that they will, so like we can't really deal with that. So I'd like them to address what is the state's expectation.
Okay, thank you, Julie. Robin Bolduc, please go ahead.
And I apologize if this was already asked. I'm balancing 10 things at the moment. So question for Department of Labor would be, is there any way we can create a waiver for spouses under CDASS to the rule that we don't qualify for unemployment, just as the fact that we are employed by spouses? So that would include someone like me who's married to a CDASS client. It would also include, which is probably happens more often, that the AR is a spouse to an attendant. So that probably happens way more often. And I was told by Department of Labor that I did not qualify for unemployment because simply because I was a spouse, and it has nothing to do with CDASS. It has to do with business practices or rules. So the question becomes, since this is a unique situation, is there a way that we can get an exemption for spouses in this particular circumstance? I mean, I'd be happy to pay into that.
Okay, thank you. Julie, Kurt, I saw your hand up before. Did you have something?
Yeah, I just wanted to clarify what I think Robin is saying. Emily, make sure it would be, is this an IRS rule? Or is it a Department of Labor rule? Or we know it's not a CDASS rule, but just need to clarify if that is something for the IRS or if it's the local labor department.
Sure, thank you, Kurt.
Thank you, Danny. Looks like Danny Comstock. You're up next.
Yeah, I just wanted to ask the group too, because I think just like HIGPUF, CDLE is a pretty large organization as well. And so I think some of these topics might fall across multiple different teams. So we have to prioritize getting someone to speak to the group. Is there a topic that seems to have higher priority for this group than maybe a different topic?
Any responses to that, folks? Raise your hand in the webinar. Type your name in the chat. Okay, Julie, go ahead.
I think they're all important, and I'm wondering if we could give them the list, and if they can't all come at one time, maybe we could have them come at different times, or there might be some stuff they could just give us in writing. Because I think the reason you're not getting a response is that I don't feel like any of us want to say someone else's issue isn't important.
No, sorry, Julie, I want to clarify. I wasn't asking about level of importance. It just meant like if any of them were more time sensitive than others, just in, if we do have to work with multiple teams, if we needed to request one team come before the other, if they can't all come at the same time. That's all. It's just
Okay, I'm not aware of any time. I guess I'd maybe say the taxes can go last because we've got more than 6 months before taxes happen again.
Thank you.
Thank you. Lorraine, please go ahead.
So I would say the topics that would take priority would be the topics that take out of the consumer's budget themselves. So like if the FMLA is taking a percentage of the budget and that's costing the member more money, I would say that those are probably the topics that my clients are more interested in.
Okay, thank you, Lorraine. Kurt, again, looked like you unmuted, had your hand up, I believe. Anything else? Kurt Wolf? Okay, perhaps not.
Sorry about that. It took a little bit for me to unmute. No, I don't have anything else. I just wanted to ditto what she said. I do get a lot of questions regarding the family members and exemptions. So maybe that might be something regarding the IRS question.
Right. Kurt, I think just in general, you are coming in clear today, but there is some background noise that makes it a little hard, but I think we followed you there.
Okay, great. I got someone else working in my office as well, so my apologies.
Oh, no, no, no. Okay. Hey, anything else? Any other responses to Danny on her question? Further thoughts or comments from the group on this? Okay, Emily, anything else? Emily, Danny, before we move on?
No, I don't believe so. We just wanted to thank you for your time and for the ability for us to be able to present those questions to the Colorado Department of Labor and Employment. So hopefully we can get some good responses. Thanks, everyone.
Okay, thanks. We are now not as nearly as far ahead as we were, so I will call time and we will take a break and we will come back right on time at 2:30 so that people who are calling in for the breakout rooms won't miss that timing. So a little bit of a longer break. So folks, I will talk to everyone again at 2:30 p.m. Thank you. Okay, everyone, this is John Barry, and it is 2:30. And I want to welcome everyone back to our second portion of the PDPPC meeting today. We are, let me make sure folks are actually hearing me. Staff, anyone? Am I coming across?
Gotcha.
Okay, thank you. Okay, we are going into the breakout rooms. I believe I just have a communication from a staff. Let me just check that real quick. Okay. I need to do a better job of reiterating to everyone before we start the breakout rooms when they're going to end. So let us start with that. It is now 2:31. So Jessica, can you confirm when the breakout rooms will end so that I will close them out at the proper time and people can know what to expect?
Sure, yeah. So we're scheduled from 2:30 to 3:05.
Okay, thank you. Sometimes we vary a little bit from what's on the agenda just due to time, so I thought I'd check. So thanks, Jessica.
Sure. I can
Please,
help
we
to
will now-
kick us off if that's good, John.
Yes, thank you. Sure.
Okay, sounds good. Everyone, we have breakout rooms as we typically do. So there's two ways to access the breakout room, and you can select the room you want to go into. One way is there is a pop-up I'm trying to get going. Okay, so they're open now. If you don't see the pop-up screen, if you're connected online, show up, then go down to the bottom of your menu and select breakout rooms. That should bring up the menu. And from there, you will see the 3 rooms to select. So members only, IHSS, and then the FMS training and case management room. If you're calling in, then give us a minute to have people get into the room of their choice, and John will help to assign you to the room you'd like to go to.
Very good, thank you. And I'll start a little ahead of myself, but Ron Heller, I see you there. And so I know that which room you go into, and I will put you there. Is there anyone on the phone only who wants help to get into a room?
Renee, members. This
Renee?
is Dolores. I'd like to go to number 1.
Okay, let's start with Renee. Renee, the last 3 digits of your phone, Renee?
762.
Got it. Room number 1. Dolores, the last 3 digits of your number?
7364.
Got it. There you are. Anyone else need any help getting into a room?
John,
Yes.
Can you hear me?
Yes.
Can you send me to IHSS 227?
227, check. Okay, very good. Anyone else? If you're online and having trouble figuring it out, just unmute and let me know. I can help you.
Hi, this is Arnetta. I am having trouble figuring that out.
Okay, Arnetta, do you know which room you would like to go into? We have 3. I can go over those again.
That would be great.
Sure. Members only. So members, family advocates kind of deal. IHSS, in-home support services. And the third is financial management services agencies, training, case case management agencies?
IHSS, please.
Thank you. Anyone else?
John, this is Larry Martin. I just messaged you IHSS, please.
Okay, Larry, IHSS. Anyone else?
Hey, John, are you there?
Kurt, is that you?
Yeah, is everyone still in breakout sessions?
Yes, until 3:05.
Okay, I'll just hang out.
Okay, everyone, this is John Barry. Oh, we need to have the breakout rooms closed. I am to figure out how to do that. Go. For those online who are in this room, we are the breakout rooms will all close in about 45 seconds. So bear with us. And again, we are waiting for the breakout rooms to completely close in about 10 seconds or so. Okay, welcome back, everyone. This is John Barry again. We are here with the PDPPC after the breakout rooms. Thank you. And so we will move to item number 11 on our agenda, our subcommittee and work group report outs. And I will start with the expanding CDASS item, the co-chairs, Kurt and Kevin. Is Kurt still with us? And
I am, John.
Kevin, looks like Kevin's with us as well. Thank you, Kurt and Kevin.
So,
Go ahead.
I kind of had the ball on expanding CDASS. I have not pursued that any further. I know Robin Bullock was on it. I did talk briefly to Oliver about it, but we never got hooked up. So my apologies. I've been a little bit busy on that. So I have nothing to report on expanding CDASS. Robin, if you're here, did you have anything else you wanted to elaborate on?
I got nothing. So sorry, life gets in the way sometimes. So yeah, it got put on the back burner.
So we will have something next month, I promise.
Okay, thank you, Kurt. Looks like the next bullet item was addressed earlier in the meeting. And then we are going to have utilization review, utilization management next report in July. We're good there. In-home support services, IHSS subcommittee. We do those during our breakout rooms.
Yep, and we just a quick recap with that is we discussed a recent memo that was released for base wage. We discussed a few of the different topics that came in regarding getting clarification over documentation needed for exercise. We also discussed some information as far as contact information, which I know the chat is usually open during that time, so you probably saw that pinging through as we went through our items. So CDPHE, or the Colorado Department of Public Health and Environment, provided some additional, more specific contact information, which was shared with the group. So overall, a really great conversation, and we kind of wrapped that up for the month. So thanks.
Thank you very much. The next item on the list, I'm afraid I know we're not reporting on it, but I just want to acknowledge that that's going to be next month, and it's NCAPS, which in the moment, I forget what that acronym stands for. We will do it next month at any rate.
Sorry, John, this is Emily. It stands for National Center on Advancing Person-Centered Practices and Systems.
There we go. Next month. Thank you, Emily. So we are heading toward the end here. Mindful of everyone's time, we're going to stick with timeframes for each of these items so that we make things fair and equitable. So the next item is a 5-minute item, and question of timesheet rounding that came up, which was a request. Jessica, please. Thank you.
Yes, thanks, John. So this item was a question that was raised the last couple of PDC meetings by a stakeholder. And so the question was essentially, why do attendants have their time rounded to the nearest 15-minute mark? And so to answer this question, fundamentally, our FMSs are required to follow federal and state law when paying employees, paying caregivers, and they, in this case, are following the Fair Labor Standards Act, which does allow for hours to be rounded to the nearest 15-minute mark. And so as long as that is applied fairly, that is acceptable. And HCPF does ensure that this is followed properly. In this case, the FMSs are doing that. And so if there's any variation in their approaches, whether they're rounding or not rounding, as long as it's in compliance with that law, they are allowed to do that. So if there are any questions about a particular attendance wages, I would encourage you to reach out to your FMS to ask anything more specific.
Okay, Jessica, thank you. So any questions at this point, Jessica? We are saying to stakeholders to contact their FMS agency. And that contact information is on our website. If you can't find it, you know, John Barry, you can contact me and I'll point you in that direction. Thanks, Jessica.
I'll just point
So
out, we
now
also have the FMS contact information on the Participant Directed Programs webpage, so you can also look there. Thanks, John.
Sure. Folks, we are moving to our final item. The item 13 we had done already earlier in the meeting. So we're going to our second and final open forum for the day. And again, just as a reminder, announcements, it's to put forward questions that can be followed up on, but not entering into discussions about them, since obviously we wouldn't be prepared. And also, if you're having trouble with the agenda topic request form, or if you're just on the phone, you can certainly use this time to make a request as well. So do we have any items? Looks like we have 2 people so far for the open forum. Anyone else? 3, 4, there we go. Okay. Well, I will start in order and with stakeholders, non-department stakeholders, and then I'll get to the staff. So let's see. Nathan, go ahead, please. You have 2 minutes, Nathan. We want to budget our time here. Thank you.
This should take just half a minute. The breakdown meetings, we had noticed that, you know, of course, in the CDASS portion and the member portion, that we miss out on a lot of the discussion with the IHSS members. And we know there's a similarities that we think might benefit our own thoughts. And I just wanted to clarify, there would not be an issue with any of our members joining that meeting, correct?
Nathan, stakeholders are free to join any meeting they like, with the exception that people who are not members and family members are not to go into the first one, which is members only. Yes, sir.
Perfect. Just wanted to clarify that so we understood clearly. All right, thanks.
Yeah. Okay, next up we have Jerry Ferroni. Jerry, please go ahead.
Okay, since most people here, and we have what, 40 or so folks, if people are really happy with the concept of self-direction, consumer direction. Please spread the word, publicize, and tell the world about what a good program this is. I mean, even when, take a minute when you go to your doctor visit, just let the doctor and staff know that CDASS exists. Most of Colorado has no clue that this wonderful opportunity exists, and we need to spread the word and let more people be aware of how wonderful it is to, for individual Medicaid members to be employers of their own staff, and the advantages monetarily of choosing pay rates and hiring and firing and everything. So I'm just encouraging that. Thank you.
Thanks so much, Jerry. All right. I ditto, Adam. You're pretty amazing. So thanks, Jerry. Aaron, you're up next.
Hi, everybody. Happy Wednesday and PDPPC Day. This is Erin Thatcher, the Participant Directed Program Supervisor. I'm just going to provide a little information for all of you about the base wage. I know Emily mentioned it in the IHSS work group, but or subcommittee. Essentially, there's been an update to the base wage, and this goes into effect July 1st of 2023. And so if you're in Denver, that means the minimum wage is $17.29 for any worker in Denver, and then across the state, non-Denver, the base wage is $15.75, effective July 1st of 2023. So for CDASS, you don't need to worry about reporting anything to the department. We get info from the FMS vendors. And then for any IHSS agencies, you probably know what you're doing, but if you don't, there's a memo that I'll link to in the chat. We were lucky to have the legislature approve rate increases to make this possible. So we're very grateful for that. And I will just say on the CDASS, and actually CDASS and IHSS in self-direction, we find that our providers and members pay far better than a lot of other service providers. So there probably won't be too many people impacted by this, where you'd need to have your rate go up. But if that is the case, if you have questions, please reach out to your FMS provider or IHSS agency. So thank you all. And Emily plugged the memo into the chat, so thank you, Emily.
Okay, thanks, Aaron. Let's see. We'll go back to advocates first, and then we'll do staff. Julie Riskin, go ahead, please.
Yeah, I just wanted to thank Aaron for that message, and I'm glad that that agencies are going to have to report to the department, because I'm hoping that as the department looks at what they're paying for what they get, that will be addressed. So for example, if you're getting CNA, like if you're doing regular home health and getting CNA level CNA rate, and then you're paying like $18 an hour, I would hope that if you're getting that kind of data, you'll be able to address that. So I just wanted to thank you for that. And yeah, and I hope none of us are paying that low on CDASS, because our workers deserve more than that. Thank you.
Thanks, Julie. Okay, and we do have one more hand up. I just wanted to say, while Jessica's talking, if you do have an item for the open forum, please raise your hand, type your name in the chat. I will check one more time after Jessica before we wrap. Jessica, go ahead, please. Thanks.
Yeah, I just wanted to follow up on the item from this morning about the recommendation process. I was incorrect when I said individuals had to attend PDPPC 3 meetings in a row. So it's just 3 in general. And I'll also add that the department does not have voting rights.
Okay, thanks, Jessica. Anyone else for the open forum? We are without any further items at the end of the meeting, so I'm just checking again. Let me actually also ask if there's anyone who's on the phone who has not given your name for attendance today. Or if you're online and you had trouble with the attendance link, you can take this moment to give me your name. You can unmute by pressing *6. I have about 4 or 5 people for the phone only, so I'm pretty sure I got most names. Okay. And the attendance link, thanks, Emily. She placed it once again in the chat if you haven't used it. Okay, that brings us to the end. And thank you all very much for attending today. The next meeting is the 4th Wednesday in July. July 26th, you'll see at the bottom of the screen. So we hope you'll join us then, and thank you all very much, and have a good 4th of July holiday weekend. Thank you.